Hi, this is Joseph Pate, better known as Medicare Joe, and in today's video we're going to talk about why I always recommend adding a hospital rider when you're on a Medicare Advantage plan. So stay tuned. Welcome back. As I said, I'm Medicare Joe, and today we're going to be talking about why I always recommend adding a hospital rider if you're on a Medicare Advantage plan. There's a red button here at the bottom of the video that says subscribe. We will post new Medicare updates and different Medicare news videos throughout the year. And if you want to be notified when we're posting those videos, click the red subscribe button in the bottom right-hand corner, and that way you'll be notified whenever we post a new video. So again, we're talking today about Medicare Advantage plans and the reason why I always recommend adding a hospital rider. Now, Medicare Advantage plans, if you're on one already or you're turning 65 and you're considering going the Medicare Advantage route, primarily the Medicare Advantage route, we find a lot of folks will go that way if they're healthy and they can't come to terms with paying the extra premium for a supplement plan. If more information on Medicare supplements versus Medicare Advantage will be in the link below this video. But a lot of people that go the Medicare Advantage route are either one, not willing to pay the premium for the supplement because they're not using their insurance a lot. They'd rather take on the risk of just paying copays with Medicare Advantage. Or number two, the cost of the supplement plan is just outside of their budget. And therefore, if they can't afford the supplement plan, they have to go the Medicare Advantage route. So again, Medicare Advantage is still a great option. I'm going to show you why with a couple of extra add-ons and riders, it can really make the plan better than what the bare bones coverage comes with. So let's dive into what a standard Medicare Advantage policy will actually look like, with their summary of benefits on paper. Now, I can't talk about any specific carriers just due to compliance issues, so we're going to keep it very basic today and go over just the ideas of what an Advantage plan can look like. So first and foremost, Advantage plans, they can be great because you're just paying your Medicare Part B premium. Most of the time, that is it. There's no additional cost for you to be on a Medicare Advantage plan. They come with dental, vision, some extra hearing benefits, and a lot of times they have low copays for doctor visits, ER visits, etc. So basically, the concern for most people on an Advantage policy is keeping their costs per month, their premiums per month, as low as possible. And I completely understand that. So basically, for a bare bones Medicare Advantage policy by itself, the cost per month would be the Medicare Part B premium, which is right now $164.90 per month. So that would be the premium that you'd pay. And then the way the plan would look is your primary care doctor visit typically is going to be free. Your specialist visit is going to be about a $30 copay each time you see a specialist. If you go to the emergency room, you're looking at a $90 copay. Physical therapy, $20 copay. So a lot of these copays are reasonable, and people have no issues coming up with the cost of that, from time to time throughout the year. However, the biggest expense on an Advantage plan is going to be for a hospital stay. Now, this can vary depending on the plan, but from what I see with most of these plans, and we're licensed in 32 states now, the average is about $300 to $400 a night for the first 4 to 5 nights of a stay. So, and here's a couple examples. Here's an example of a plan. This one's actually $290 per day for the first 5 days. Again, I'm leaving carriers out just due to compliance reasons. I don't want to upset any insurance carriers for posting this video. Here's another example, $370 per day for the first 5 days of a stay. And here's another one that I'm putting up here, which is $360 per day for the first 5 days. So, like I said, on average, we see about $300 to $400 a day copays for these hospital stays. And now, when you look at this, one night in the hospital, you're probably like, okay, that's not terrible. I can come up with a $300 copay. But let's look at this and say, what if you're in there for 2 nights or even 3 nights, not even the full 5-night charge that they can actually charge to you. Let's just say you're in there for 3 nights, even at the $290 per night cost. I mean, that's just shy of $1,000 in copays that you, the insured, are responsible for paying. So most folks on an Advantage plan, again, they're happy with the lower premium. They're happy with all the lower copays that I just went over for the doctor visits, etc. But this cost for the hospital can definitely be a burden on folks to come up with at one time. And especially for people that are going the Advantage route because they can't afford a supplement premium every month. Well, if you can't afford the supplement premium, which is about $100 a month, how in the world are we going to afford a $1,000 hospital stay bill for a 3-night stay? So, I understand sometimes that the $100 premium might be out of budget, but there's ways to work around this $1,000 hospital bill in an affordable manner that you can actually just add to your Advantage plan to spruce it up and make it a little bit better. So what's the solution? I'm going to show you that right now, and this is why I always recommend a hospital indemnity plan, also known as a hospital rider. So the way that it works and why I'm so passionate about this is you have, so let's use the example of the hospital stay that we just said. You have a hospital copay that's $300 per night for, let's just say, 5 nights, okay? That's how the copay works with the plan, with the Advantage plan. The hospital rider will mirror the benefits. So basically, if you have a $300 copay per day for the first 5 days, the hospital rider is actually going to cover and pay the $300 per day copay for the first 5 nights of a stay. So this means that your actual out-of-pocket cost is going to be 0, nothing. The hospital stay is covered in full for that copay. So again, we're looking at this quick example that I've marked up here, $300 copay per day for a 5-night stay. You're going to be paid, or the bill will be paid at $300 per day for the first 5 days for the hospital rider. So you come out paying nothing for that hospital stay for copays. A lot of these plans actually will cover also emergency room copays. So like we said before, the emergency room copay was a $90 copay. The hospital rider will also cover ER visits up to that $90 copay, or maybe up to $150. It just depends on the benefit level and how it's set up for the ER reimbursement. So as you can see here, I mean, this rider by itself takes away the number one exposure on a Medicare Advantage plan and the number one cost that people will incur with these plans. So why am I so passionate about this hospital rider? It's because of the cost. You can add these riders to any Advantage plan for about $20 to $25 a month typically. That's it. So in theory, when you add on the hospital rider, even at $20 or $25 a month, if you have one stay overnight in the hospital during the year, your plan just paid for itself. If you're in there at any point for more than one night throughout the year, you're actually making money on the policy and it's helping go towards your coverages. So, when we do that out with people, we look at it in terms of, okay, let's look at not just this year, but let's look over the next 4 or 5 years. Will we possibly be hospitalized at any point during that window for 3 nights, 4 nights? God forbid you're hospitalized longer than that and something serious comes up. This can really help with that number one exposure that Medicare Advantage plans have, which is the hospital copay and the cost for that. So let's break this down in terms of if we're looking at just a regular Medicare Advantage plan. So if you're looking at just turning 65 and getting onto a plan, or maybe you already have a Medicare Advantage plan, this is your bare bones coverage. You have your premium for Medicare of $164.90. And if you are hospitalized overnight, you are still responsible for the largest cost on a Medicare Advantage plan in terms of copays. So you have a 3-night stay, you have to pay the $1,000 copay, which is at $300 a day for the first 3 nights. Or you can have a Medicare Advantage plan with the hospital rider. So you'd have your premium of $164.90. Let's just budget the hospital rider at $20 to $25 a month in premium. So your total premium would be somewhere between $184 and $190 in total premium per month, compared to $164.90. And if you have a hospital stay at any point during the year with the hospital rider added on there, you pay nothing for the hospital stay. It's completely covered for you. You are eliminating the largest cost on an Advantage plan by just paying a little bit more in your premium. So, with these hospital riders, it's one thing to look at this and say, well, I just want the lowest cost, just sign me up for the lowest plan. But in reality, these hospital riders should be given a lot of thought as to how you actually want your insurance to work, not only now for the little things that pop up, doctor visits, but the major things that can occur. So a lot of people ask me, okay, Joe, this all sounds great, but what's the kicker behind all of this? So obviously there's always, a kicker when it comes to insurance and how to get this type of policy. So our office, our agents here can help you with this, but the most common question that I get when we're going over this with folks is, I'm not anticipating any hospital stays in the next year. Can I add this on, later on, maybe 3-4 years down the road? And of course, you could at that point, but the idea of how these plans work is when you turn 65, they are guaranteed issuing you into the hospital rider, meaning you don't have to answer any health questions at all. So when you're turning 65 or just after 65, typically, you're able to get these plans with no health questions asked, which is the time to do it because that's the time that you're going to be able to actually buy the plan. After you turn 65, let's say maybe you're now 69, 70, and you've had a few health conditions that have popped up and you're really seeing the effects of having that cost for hospital stays out of pocket. At that point, the insurance company is going to say, okay, we'll still sell you this type of policy, but you're going to need to pass our medical underwriting. And at that time, a lot of people can't get through their medical underwriting to be able to purchase the plan. It's too late. So the best time to do this is when you're aging into Medicare, turning 65, because the insurance carrier is giving you a one-time ticket to buy the plan without having to worry about answering any health questions at all. Now, if you're watching this video and you have an appointment already scheduled with one of our agents, make sure to mention the hospital rider. If it's something that you think is a good fit and can work within the budget, on your one-on-one call, our agents can give you exact pricing on what that hospital rider would be in your area. If you are already one of our clients and you have an Advantage plan with us and you missed out on speaking about the hospital riders, or maybe you've given it some second thought after your call, now's the time to reach back out to us by calling the number below and scheduling a call so you can get that added to your plan with no health questions being asked. And maybe you just came across our video from searching Medicare Advantage plans and you'd like to speak with one of our agents. Again, our number and link to our calendar will be below so you can schedule a call with one of our team members and we can help you as well get exact pricing on the hospital riders. And if you've enjoyed this video, if you could, please hit the like button at the bottom here. The way that YouTube works is the more likes a video gets, the more popular it is, and that way it will be shown to more people. So if you thought and took anything from this video that was of value, please hit that like button. If you'd like to be notified when we post new YouTube videos, you can hit the red subscribe button below. That will notify you whenever we post new Medicare news and update videos, so you can watch those as well. Any questions you have, you're welcome to drop them in the comments below this video here. I personally go through those and answer any questions that you may have. Any questions that you do have, we would love to answer. So please post a comment below if you have questions, or if you'd like to make a comment on the video and the content that we went over here today. Again, this is Medicare Joe, and I want to thank you all for taking the time today to watch this video. Hope you've learned something new. And as always, we're here to make Medicare simple. Take care.